Welcome to Queen City Cyber Consulting's channel.
Well, hello, Queen City Cyber Consulting followers, listeners, subscribers, whomever you may be. Good morning. It's morning where I am. And I came across some information over the last couple of days that I've been processing and thinking about and researching and growing more and more. I don't think alarmed would be the right word, but it's not far from the truth. Healthcare. Healthcare itself is in sad shape these days. Uh, whether you're going to a hospital or a doctor or seeking treatment for whatever, there are a myriad of problems. From personnel to the care itself to wait times to pick a topic, misdiagnoses, it's vast. I work in cybersecurity, as I'm sure you're aware from the channel's title and content. And cybersecurity definitely affects healthcare. And coming across some of this information and reading about it and seeing some various articles on it raised the hackles on my neck, as my pappy used to say. And that is because I live in a single hospital community. The closest backup facilities to our local hospital are roughly an hour, hour and a half away. Hour if you're driving fast, hour and a half if you're obeying all traffic laws and speed limits. So when a cyber incident hits a hospital, it's beyond IT. It becomes a public safety crisis. And it does directly affect our patient survival rates. And that's what this video is about. So what happens? Geographic isolation and cyber risk go hand in hand. This is something that's often overlooked or ignored, or it's one of the white elephants in the room that nobody wants to talk about. It's something that needs to be talked about and needs to be addressed by local community leaders, by local community healthcare leaders in a direct and open fashion. And these are just some examples here. There is no close fallback. In these isolated regions like the one that I live in, you only have one hospital within a roughly 2-hour drive or so. I said an hour, hour and a half. That's what it is for us. There are probably other areas it's longer. And that's if you can get the transport to get there. And that's if that hospital is accepting incoming patients. There's a variety of factors that come into play. Any kind of disruption to the network could just completely destroy that local safety net. And in a community like mine, where there is only one hospital, we used to have two. Several years ago, those two hospitals were disintegrated basically and merged into one. This one hospital, which is pictured here, they have less beds than the other two hospitals together in a population that's still roughly the same. It's created backlog issues. It's created other issues. I was in the hospital this past year multiple times, and to my stunned surprise, there were floors on the hospital that are just completely empty. Entire wings of the hospital where there were no patients. When I was released at one point, well, 2 points, I was taken from the room I was in, transferred into an empty sector of the hospital, and sat there for an hour or so waiting for my release papers and a nurse to clear me to get me out of there. And in that time that I'm sitting and waiting, both my wife and I wandered the halls in this wing and marveled at the fact that this entire wing was empty. And we were told when I was checked in that we had to wait for a room. There were no rooms available. Well, that's because entire wings of this hospital are not used. It's cost saving, I guess, on the hospital administration's part, but it's adversely affecting the patients. And that's going to come into play if this local hospital system ever comes under cyber attack, which it will. I mean, it's only a matter of time. The electronic health records could be blacked out. That shuts down everything from your diagnostic lab imaging, which is nearly all online these days, to drug dispensing units. You end up with transport delays. If there's a motor vehicle accident in the midst of a hospital blackout, where do you take the patients to? That hour and a half long trip to the next hospital down the road. What happens? That lowers your survival odds. And of course, your staffing has vulnerabilities as well. Can they switch over to paper-based workflows again? Can they manage the surges that are going to happen during a cyber attack or event? What happens at the height of influenza season when the RER is filled? And I'm talking filled. We've been in the ER in the last year, and it was packed to the gills with sick people. Well, some sick people and probably some others not so sick. So a cyber attack is just going to cripple these isolated medical systems, and it's something that needs to be addressed by the community. Looking at Dr. Andrew Huff's research, he's published it. It's out on Substack, on his website, and other places. That's part of what got me going down this road. Shows that a ransomware strike increases by 1/3, approximately, hospital mortality for patients who are admitted when an attack begins. What causes it? A lot of things: delays in processing and diagnostics, missed warnings of medical conditions like sepsis, and delayed cardiac interventions. And it drives up the mortality. Now, nobody talks about that outside of someone like Dr. Huff, who is a recognized epidemiologist. Now, if you have to go look up the word epidemiology, don't feel bad. I had to do that myself several years ago because I was a fairly frequent public speaker, and a friend of mine was supposed to speak to a cohort of medical professionals, social workers, community leaders on epidemiology. And he could not be there. So I was recruited to take over the presentation and run the show. At the time, I had to go look up what epidemiology even was. I will admit my own ignorance when it's necessary. Guess what? I learned a lot. I studied the topic out and I did the presentation. And I had doctors and nurses and doctoral candidates and others come up to me after the presentation and say, "You brought up things we never thought of." That's part of community. That's part of dealing with these kinds of things in a holistic manner. I was a police officer at the time. And one of the issues that I mentioned was during a epidemic, a real epidemic. One of the problems is people traveling in and out of the area. And as a police officer, I already knew there was a heavy amount of traffic for drug dealers and drug users, leaving our community, driving to the closest urban community to purchase their drugs and driving back. Passing through numerous communities, oftentimes stopping along the way to partake of their illicit booty. And then you had the drug dealers who would also travel to our location, make their drop-offs, drive back. So if there is a infectious disease outbreak in an urban area, we can't just assume we're cut off from that, because there's a lot of traffic that moves back and forth, and that's just the illicit criminal traffic, let alone tourism, business deals, and things like that. So oftentimes we silo ourselves off, and that is a weakness, and we definitely have to get past that, especially when we're dealing with a cyber attack. And it's not enough to just blithely say, oh, well, we're protected, it can't happen to us. Yeah, well, people have said that now for decades, and guess what? It happens to them. So, in Dr. Huff and other people's writings, what they found was ransomware attacks on hospitals, which is one of the most prevalent ones, directly elevates patient mortality. These time sensitive conditions like heart attacks, strokes, sepsis, they actually suffer really great harm from delayed lab test results, from manual charting backlogs, from information sharing between nurses that are dealing with them. It's just a factor of reality. Then it has a regional ripple effect. It spreads. When this attacked hospital that has to shut down its network for a period of time begins diverting ambulances into other neighboring regional facilities, those facilities now have to absorb this increased patient load, which triggers more degradation in patient care and more emergency department overcrowding on the part of the other facilities. And if you're a patient, you don't have a choice. You're not going to get into your local hospital because they're shut down and they're diverting everybody to other locations. So it's something that you should be thinking of, whether you work in a hospital setting or whether you're just a regular person that may have to go to a hospital setting. Now, when it comes to cyber hazards, a lot of times they're not recorded. Unlike COVID, where if you fell off a ladder and died or died in a car wreck, you were listed as a COVID mortality. For cyber attacks, they don't list ransomware on death certificates. They just record cardiac arrest, organ failure, sepsis, infection, whatever it may be. So the real casualties from these cyber attacks really are not known. And that's kind of frightening from a patient's point of view. These patient records, they lose access to them. Your medical history, they can't find it. If you have drug allergies, they don't know. Do you have any prescriptions that you're taking now? Are there any prior scans? Like this year, I told you I was in the hospital. They scanned my entire body, head to toe, and almost every single scan you could think of. They even did an MRI on my brain at one point, trying to figure out what was wrong with me. That's gone in the event of a cyber attack. I could show up with, say, went back into having physical problems again, go back to the hospital. Guess what? They don't know what happened to me before. And if I don't have a patient advocate with me, such as my wife, it's going to be hard for me to explain to them what happened to me over the past year, what surgeries I had done, which I did have 2 surgeries done throughout the year. They're not going to have access to any of that. That's going to lead to a lack of treatment or mistreatment in the end. And then, of course, the diversions that we talked about are going to have an effect on what treatment patients are going to get. What are the ransomware downtime trends? Well, it's not getting any better, folks. You can see it just continues to rise out all the way up to this year. We're up to about 5 days downtime. This is the average IT blackout duration. It's going up over time, which you have to wonder why. What's going on inside the hospital IT center? How are they training for this? How are they dealing with this? Are they putting adequate funds toward it? Do they have the proper staff, proper training? All those are questions that should be being asked. And I know things like physical security are important in a hospital. The question I have is, where's the money going? Where's it being spent? And I can tell you already from insider knowledge that too much money is being spent on the administrative staff. and not on these kinds of day-to-day things that affect the patients who are seeking care at these facilities. So what do we do? What's the response? Well, if we're going to mitigate this, especially in isolated communities like the one I live in, it's going to require some synchronized actions. And that involves you, that involves hospital operational teams, and that also involves regional emergency management systems. That all are going to have to sit down, work through this problem, and deal with it. And that's part of why I made this video is hopefully, maybe, let's spark some conversation, have some meeting. Let's talk about what's going on and how we can better prepare for it. For you, the person, you need a health folder ready to go. When I was so sick last year, um, I had a go bag. After my first visit to the hospital and I was admitted for 4 days, after I got home, I made up a go bag. And in that go bag, I had some printed records of the medications I was on, any allergies I might have, and little things like you may not even think about. You want your cell phone. Well, you need a charger. You're not going to get a charger in the hospital. You need a charger. Any extra medication you might need. You need to have at least records of that so that if you need it, they can get it to you. Just some vital essentials, a change of clothes, for example. Those are things you need to have prepared and ready to go, especially your secondary contact information. Let's say you're in a car wreck. You definitely want to have something there that provides your, what do they call them, patient care advocate contact information so they can be called and get to the hospital to be there with you. You need that second person in case you're not mentally capable of making decisions. Believe you me, you don't want the hospital doing that for you. You need buffers for your medication. A lot of people say between a 14 to 30 day reserve of what is considered critical life sustaining daily medications. You need that on hand so that if, say, your local pharmacies go down, you can still have the medication until they get back up and running. That's something that a lot of people don't think about. Definitely consider first aid and trauma training. Get some CPR, basic first aid. Learn how to do some emergency treatments in case you have to do it in the event that, say, ambulances are being rerouted to an hour, hour and a half, 2 hours away, and there may not be an ambulance available to respond to a problem that you have. So you need to deal with it immediately in order to be able to protect that life. And keep your physical lab records. I mean, if you've had testing done, get physical copies of it and have them in your go bag so that you can take them with you. Like mine is just immense. My file folder is super thick from everything I had done last year, but I keep a copy of it ready to go just in case something should happen and I will need it. The hospital itself has to drill regularly on paper workflows, offline work, taking care of manual drug administration. I mean, right now you go in the hospital, you've got your little wristband on, they'll scan it, the computer pops up what meds you need, they dole it out from that and serve it to you. Well, imagine they can't scan that little wristband anymore and they don't get the pop up on their computer because the system's down. How are they going to know what medications you should have? That's where your go bag comes in very, very handy, especially if you're on life-saving medication. You need to have that. But the hospital also needs to be working on making sure that the nurses and aides, the doctors are able to operate and work day to day without computers. And they need to make sure they have redundant satellite communication set up so that there are communication pathways not only between the hospital, which is under attack, but those satellite locations where the patients are going to be rerouted to. That way, let's say you live in, let me pick a county that's close by to me. You live in say, Bedford County. Well, your local hospital is down because of a ransomware attack. So you're going to be shunted to Pittsburgh. Does Pittsburgh have the ability to call and talk to the Bedford facility to find out your medical history if they need to, or do you have that go bag ready to go? Those are all things that you have to take into consideration for an event like this. So here is just some readiness that we need to talk about. We cover a variety of things here. Your county leadership needs to know what to do. Your EMS, first responders are going to be involved because they're going to be transporting patients out of the area. They're going to have bottlenecks to deal with. They may even have radio outages. Remember the one video I did just a bit ago on the 911 call center out in California being struck down by a cyber attack? It happens. So they need to have some off-grid communication set up and also some secondary triage sites and personnel to man those. And hospital operations we've talked about pretty much in depth. And of course we talked about us, the patients and the households. So let this spark a conversation in your local community, especially if you know that if your local hospital goes down, your nearest help is an hour, hour and a half, 2 hours away. And reach out to your local community leaders to get them involved and start the process. If you need help doing that, feel free to comment. Feel free to reach out. Share this video with your local community. Spark the conversation. That's how this process begins and grows. Thank you for watching. Take care. It's Queen City Cyber Consulting signing off. Go forth and conquer.
Thank you for watching. Please like, share, and subscribe.